I want to thank you all for being here for our 36th consecutive community rally to defend democracy. Should we have a holiday party? So we have much to celebrate. By now you've probably heard that there was a blue tsunami in our country.
Woo!
In Connecticut.
Woo!
And in Bethel.
Woo!
So while there hasn't been a change in our first selectman, there have been many changes to our boards and commissions.
Wait, we're not going to use the full.
And that's all
That's
good.
what I thought.
Terry, we need the full.
Can you hear me better now?
Woo!
All right, I'm going to go back and say again, we have much to celebrate today.
Newtown.
So we know that our movement is the reason behind this success. We are activated, and when others see us speaking out, they know that they can vote for change too. So today we celebrate!
Woo!
So first a few announcements. I'm Terri Nackid, and I'm part of the Bethel Rally organizing team. Our members include Carolyn, Kathy, Cindy, Greg, Kennedy, Sue, Veronica, Nancy, Katie, and Lisa. And we're always looking for more people to join us. We'd also like to shout out to the businesses in Bethel who support our right to free speech. Kate and Dee from Reading Roasters, Tom Nackid from Geeks Bearing Gifts, La Zingara, Greenwood Features, Molten Java, and a special shout out to Tony Heslin from Knots Out, Shakedown Street Eats, and Fat Tony's Deli. Thanks so much to all of our Bethel businesses. Don't forget to eat and shop after the rally and enjoy all that Bethel has to offer. We also want to make sure you never miss information. We want to make sure you don't miss information about our rallies. Visit the information stoop that we have now, not a table, to sign up for our newsletter or visit bethelrallies.org. You can find videos and photos from our past rallies. Again, bethelrallies.org. Also note that there is a donation box and information about upcoming activities on our stoop. And thank you to everybody who brought items for the Bethel Food Pantry. All non-perishable items are greatly appreciated and so much in need at this time. There are a couple of events to make you aware of. So, Barry's Empathy for a Cure fundraiser will take place on Sunday from 3 to 6 at Molten Java, and it's going to benefit the Dorothy Day House. And on Friday, November 11th, from 7 to 10 p.m. at Mothership in Danbury.
21st.
The 21st?
Yeah.
Oh, on Sunday, November 21st. Sorry,
Friday,
I got that date wrong.
Friday, November 21st, sorry.
Friday, November 21st, 7 to 10 p.m. at Mothership. There's a Families Belong Together fundraiser to benefit Danbury Unites for Immigrants, featuring music, spoken word, and poetry. And there are flyers up here if you'd like specific information about that event. All right, as I mentioned before, today our focus is vaccines. Actually, I didn't mention that, but our focus is going to be on vaccines. Cathy Schaefer and I, with help from Sue Westerberg, are going to share how vaccines save lives, how RFK Jr.'s anti-vax agenda is jeopardizing Americans. So our first speaker, Cathy Schaefer, has worked as a registered nurse in pediatric surgery, as an outdoor educator for school groups, as an adjunct professor preparing future teachers, and for 21 years as a middle school science teacher. She's also a former member of the Bethel Board of Education. Please welcome Cathy Schaefer.
So, good morning, everybody. The issues surrounding vaccines are part of a broader context that dismisses science and replaces facts with misinformation. The Trump administration's war on science and medicine, led by a man with no medical or science background, has led to the spread of misinformation and lots of confusion about vaccines and health. Since January, experienced, knowledgeable people who used to head important federal health agencies Where?
Just right into the grate.
Oh, okay.
Yep, there you
That
go.
better? Okay.
Yeah.
Who used to head health agencies have been replaced by unqualified loyalists. There have been big staffing cuts at federal agencies whose job it is to keep us healthy, like the FDA and the CDC. Throughout the country, federal funding for science is drying up. As a result, science research is being curtailed. Some state and local public health agencies have halted work on important projects. These are not harmless cuts. These are cuts to programs that we need, like infectious disease monitoring and prevention, vaccination outreach programs, and disease outbreak responses. All of this is the exact opposite of what leadership would try to do if the goal was really to make America healthy again, as they claim. We're here today to talk specifically about how vaccines have been impacted by the apparent disdain and distrust for science. Since RFK Jr. has been appointed as head of the HHS, he has opposed vaccine mandates. He seems not to understand the science behind them. Of course they help protect individuals from serious diseases, and maybe some individuals are unconcerned about whether they get vaccinated or not. But vaccines also help develop community immunity, which in turn helps prevent the spread of disease. It helps protect those too young or too immune compromised to get vaccinated. The spike in cases of measles under this administration is a good example of why vaccines are needed. The recent outbreak in Texas spread rapidly with more cases in a relatively brief period than we have seen in decades in this country. Almost 90% of these cases were among the unvaccinated. At least 3 children died from a preventable disease. That's the tragedy. People dying from a disease like measles or COVID that could have been prevented by something as simple as a vaccine, a safe and effective vaccine, because people are being fed misinformation. So now that I've given you some information about what's not going well with science and our collective health, here's how the scientific community and local governments have responded. Locally and nationally, we are responding to the questioning of long-standing scientific data and public health guidance. They are providing facts to the public from people who have actually studied science and medicine. The American Academy of Pediatrics and the American College of Obstetrics and Gynecology have issued their own recommendations for vaccines, which in some cases differ from the CDC recommendations. The AAP has not diverged from the CDC in their vaccine recommendations for decades. The Governor's Health Alliance, a collaboration of 15 Democratic governors who represent 1 in 3 people in the United States, formed a coalition to coordinate public health services based on advice from experienced and knowledgeable professionals. Here in Connecticut, we are also part of the newly formed Northeast Public Health Collaborative, which consists of 7 Northeast states. This regional group overlaps with the Governor's Health Alliance, since Connecticut is a member of both. Many state health leaders, especially Democratic-led ones, have criticized the dismissal of science and research and how the federal government is making changes based on opinions rather than facts. These new alliances are one response. Even though the federal government issues guidance and makes recommendations that can and do influence public health, it is often the states that have the ultimate authority to decide whether and where to follow that guidance. We have choices. I will leave you with one more thought. Just because someone doesn't like the science doesn't mean that the science is corrupt or inaccurate.
Yes.
We don't know when or where the next public health crisis will be. If the federal government doesn't trust science and has non-scientists making healthcare recommendations based on personal bias instead of scientific data, it is vitally important that we have reliable sources of information. Scientists, physicians, and our local leaders have stepped up to make sure that those sources exist. Now I'd like to introduce Terri Nackid, who will share some more information about vaccines, their development, and why it is so important for us to continue to support science research and vaccine development. Terri has degrees in biology and works in healthcare and is an active participant in our weekly rallies. Welcome, Terri.
So, what are some of the vaccine myths that we think need to be actively debunked? First, the myth that COVID vaccines were developed too quickly to be trusted. So yes, COVID vaccines arrived in record time, but the steps that were hurried were essentially the paperwork. All of the vaccines available were tested in tens of thousands of people in clinical trials and rigorously evaluated for their safety and effectiveness. So we just made the paperwork easier. Everything else was the same as any other medical thing that needs to get approved. Another myth, vaccines will alter your DNA. The CDC confirms no vaccine will alter your genetic material. And if you look at the science and know the science, it will not change anyone's DNA. Another myth, COVID vaccines use a live version of the coronavirus. None of the COVID vaccines available in the US use the live virus that causes COVID-19, and they cannot give you the disease or cause you to test positive. These vaccines are different than some of the very early vaccines that were created. No live organism in a COVID vaccine. Myth, COVID vaccines contain microchips or can cause you to be magnetic. According to the CDC, vaccines do not contain any metals or materials that can produce an electromagnetic field. They are not used to track people. And another myth, the myth that measles vaccine causes autism. The claim initially came from a paper that has since been retracted and found to have been falsified. 30 large studies have been done showing no link between vaccines and autism. This truly was a case of one person falsifying data, and it's well documented. To be fair, there are people who should not get certain vaccines due to very specific allergies or medical conditions. Those people should have conversations with their physicians to determine which vaccines are safe for them. But this should not be a reason to completely remove vaccines from standards of care, and that is what we are hearing is happening. That is wrong. With the success of mRNA vaccines for COVID, researchers began looking for other illnesses that might be helped, especially cancer, HIV, and autoimmune disease. There are now hundreds of mRNA vaccines in development, but under RFK Jr.'s leadership, 500 million has been stripped from mRNA vaccine research. I'd like to share why this is especially important to me. 1 in 8 women will develop breast cancer. 1 in 8 women will develop breast cancer. How many of us here today have either had breast cancer or know someone who has? We all do. So at my own office, 3 of my coworkers and myself have all had breast cancer, and we're a small office. But thanks to advances in vaccine research, several vaccines for breast cancer are being developed. There are currently 3 small phase 1 studies for vaccines to prevent triple-negative breast cancer by targeting a protein specific to those types of cancer. We all know that's a very difficult cancer to have. Researchers are looking at high-risk women, and the results so far are very good. Phase 2 trials will begin in the next few months. In addition, there's a significant amount of research being done to develop vaccines as a cancer treatment, especially for those with HER2-positive breast cancer, which is what I have, and that can be an aggressive form of cancer, and it frequently metastasizes. Treatment vaccines try to get the immune system to attack cancer cells. There's a vaccine for HER2-positive breast cancer that's beginning phase 3 trials after the phase 2 results showed 80% reduction in recurrence of breast cancer in participants. Phase 3 is the final step before seeking FDA approval, and I know I follow this very closely. It is in process. We will see a vaccine for some breast cancers in the next couple of years. These vaccines vaccines will be incredibly important to 1 in 8 women in our lives. With ongoing vaccine research, it's possible that a vaccine for some breast cancers, as I just said, will be available soon. And other cancers. Many different diseases are being looked at for these kinds of vaccines. So I just wanted to thank you all for being here today. Remind you, if you haven't already gotten your vaccines that you're due for, talk to your doctor, get your vaccines. It's good for all of us to make sure that we don't get an illness which is going to affect us in a way that we can't even imagine. Thank you again for being here today. Let's keep raising awareness. Keep speaking up. Keep moving forward in defending democracy.
Woo!
It's working.